we're here today to show you how to do a dressing change for a central line. First thing I'm going to do is grab my mask if I don't already have that on going into the patient room. And then I'm going to do hand hygiene. Today we're going to use just a pretend list because this room doesn't have any place for us to wash our hands. Once I get done with that, then I'm going to put my sterile, non-sterile gloves on, clean gloves I guess you'd call them. And we're going to clean our work surface area with the purple wipes, otherwise known as sandy cloths. So this is an important, before you do anything with a sterile procedure, you want to clean your work surface area, and might I add, do not do it without gloves on because it's very harmful to your skin and your body. So we're going to get rid of this off of here, pretend I have a trash can. And then I'm going to take these non-sterile gloves off, and I'm going to do hand hygiene again. Well, I need a trash can. So, all right, going to clean again. And then I've gathered my supplies already, but I'm going to put them on my dry work surface area. So I've got my kit, our central line dressing kit. I've got a different pair of sterile gloves if I want to use those, although I think I can use the ones inside here because my hands are small enough. We recommend using what's inside the kit if at all possible, only because adding more things to the sterile field makes it a little bit more risk to add contaminants to the top of it. We know, of course, we have to customize a lot of things based off of the size and ages of our patients, but when possible, use what's in there. If my child is over 2 months adjusted age, I'm going to use a bio patch. If my child is under 2 months adjusted age, I'm not going to use my bio patch. I'm going to also get something different because inside here comes ChloraPrep. It does not come with betadine. So I'm going to get the 3 betadine scrubs that come inside here. If I don't have that available, I can use 3 of these little mini scrubs along with some of this betadine that we can get. You do want to clean the top of the cap once you open it with alcohol first, let that dry. And then what you can do is not crush this, crack this ChloraPrep, and then you can use the little cavity down here to be able to put your betadine in. Just don't use a ton of it because you do have to wait for it to dry on top of the skin. They don't recommend dabbling it with a sterile gauze. They just want you to let it dry. And if you put too much on, you're going to be waiting a long time for it to dry. So that's just a little disclaimer on that. I'm not sure that I'm going to need too much of the Surgiseal for this particular patient, but if it was maybe a new dressing and maybe a new PICC line, that a new patient that we need to, maybe a new port or something that we need to possibly apply this, I might want to put that on there. So at this point, I think I've gathered enough supplies, and I have my buddy nurse here to help me. She's got her mask on. She put a mask on the patient. She's got her clean gloves on after she washed her hands. She's going to be responsible for taking off the dressing once it gets a little bit closer to time here. And then we're also going to disconnect this. We don't have a pump, so I can't stop the pump, but I would stop the pump. I would clamp my line, and then I would take this off. Once I put gloves on, I would take this off, or she might have to since I don't have any more clean gloves. We're going to also make sure, if we're not going to save this tubing, then we can, it doesn't matter, we're going to throw the tubing out. If we're going to save the tubing because we need that tubing because it's not time to change the tubing yet, we're going to make sure at least use the cap to the end of here with a very sterile end to put on to keep that clean, or we're going to get one of the caps that we have in our pass-throughs to be able to use on. They're sometimes blue, sometimes red. So I'm going to open up one of these. Usually we have the kind that looks like this. Occasionally they'll bring us one that doesn't resemble this exact same thing, but we do like this particular one because it has a nice dressing on the inside. So if I need to use this mask, I could use that for the patient, but since we already have one on, I would either ask if a parent or anyone else is in the room within 3 feet of the patient, I would have them put a mask on as well, or stand back so that they don't contaminate the area if they're breathing. All right, I've got 2 gloves here. I'm going to just put this one off to the side in case I might need to change in my glove. Occasionally that happens where I do need to do that. So now I'm going to open this up and don my sterile gloves. I almost need a bigger workspace here, don't I? All right. Hopefully these are going to slide on nice and easy. as I'm doing this, if my buddy nurse notices that I am doing something that's not safe, or that my glove is contaminated by touching something, or my sterile field area gets contaminated, she is by all means supposed to say something to me like, we should probably get another glove, I think your glove touched something. That way we protect the patient. So inside here we have tweezers. Maybe I want to use that if I need to pick up something. I might need some tape, but I usually don't need that. We do have, this is called SurePrep, but we also have Cavalon that you can use if you don't use the kit. Here is our ChloraPrep. We've got a little tag here. I've got something that I can clean underneath of the line if need be, or get some crust off. I've got a sterile gauze. I've got 2 of these. I don't know, I got a lot of labels in this one. And then this is our favorite dressing, because it actually has what we call pants that kind of helps the end stay down. Also has a label. Super important to label with your date and your initials for the dressing, and make sure that you keep the window clean. All right. So, are we ready?
I'm going to do you want me to
Yep, go ahead and
our line?
disconnect.
Okay. I'm going to put the end of my saline on here to keep that nice and clean if we're going to use it again. I'm going to clean with my scrub hub, scrub pad. I'll do my 8 turns over 10 seconds and let it dry for 5. And then I will attach it, unclamp, check blood return, flush the line, which I can't do on our little friend here. And then I will clamp and remove. We're good to go there. And then I'm going to be sure to hold the center of the site on the line so that we don't pull the line out. We take the pants off first, which this dressing does not have pants. And then we undo around the edges and then take off towards the center. And then we get rid of our old dressing. I would then remove my gloves, do hand hygiene, and put on a new pair of clean gloves so that I can assist with the dressing change.
Yeah. And during that process, she's going to make sure and keep his hands from getting too close. So if he gets a little wiggly, then we keep him from touching this. So I'm not going to crack this because this patient I can't actually do that with. But what we want to do is we're going to clean this for 30 seconds. And it's a little awkward because we don't really have ability to just go in a circle. So they say back and forth scrubbing. I tend to scrub really close to the thing first and then kind of move further away, and don't go back in close to my area, because the point is we're trying to keep bacteria away from it. So we're gonna scrub for 30 seconds and we're gonna let it dry for 30 seconds. If it's really moist, then you would wait longer. But the whole point is you want it to dry before you put a dressing back on. Now, if we are going to use the betadine, which I can't really demonstrate this either because I don't want this to get, I'm going to try to get as much of this out of here so I don't get this on this mannequin. I'm going to scrub differently, right? So what you do is you do a bullseye around, and you go all the way out, and you do this 3 times.
Would you have your assistant nurse open that for you so that
Yes.
you've kept sterile?
This is just to show you guys and demonstrate this. Okay, we're going to go all the way around 3 times. Now, when would we use this? We would use this on patients who have an allergy to chlorhexidine, or to patients who are under 2 months adjusted age. This is the same kind of thing you would do if you're doing a blood culture. You would want to scrub 3 times with betadine. Okay, so now that we did that, and I feel like I'm contaminated, I'm going to put a new thing of sterile gloves on, and then I'm just going to put the dressing back on. I'm going to do this kind of quickly so you don't get tired of watching me. We're letting it dry. We're keeping his hands free. We're also looking to make sure that it doesn't have any signs and symptoms of infection, that it's not red. Of course, if we notice any drainage from that, I might be asking to get something to culture that. So at the time that I'm getting ready to put this on. So I've got this. You know what I forgot to do? Open up my BioPatch. But we probably don't have to open it up and waste it.
I would open it for her and she could grab it out
Yep.
and stay sterile.
Could do that, and then I would put that around. Now, the key for the BioPatch is actually that you get this tubing through that hole. We don't want to lay it on top of it. We don't want to put it upside down. We actually want to get it through this hole here. I guess I could just show you what it looks like. That's gonna hurt, right?
Print side up. You want to look at the printing.
Yes. So you
View
see
to the
this?
sky.
You're going to do this. In fact, I probably would turn it the other way because we're going to pull it down. So I'd probably put it just like that. you actually don't, I mean, we see several things. I come in and I see them just laying on top. The point of this is that the hole is only going to be big enough for this to come out because all this is medicine on here that keeps the bacteria that is on your normal skin from getting through. So you want it to be just like that. And then you're going to want to coil it just like she did. I guess we could stick it on this thing. It's not going to hurt. All right. Oops. It's kind of coming up there. Doesn't want to stay for us,
Coiling
does it?
is tricky.
It is. Okay. This little guy here doesn't want to
Ideally,
do
you
it.
get it to come out at the slot
Yeah,
at the
right
bottom.
at that slot. Perfect. So, hopefully it peels off the mannequin. Okay, so at this point then, we take our pants, and she's going to lift that up, but I'm going to put this right up like this. Does not want to come out. And then we've got this nice, if it pulls, it can't pull it down and flip this up because these pants are holding it down, which is nice. It's going to be better on skin. It's on this thing. It doesn't work real well. But this is what we want to do. Then, yes, we would take and put our label. We want to put it right on here. Somewhere on here, doesn't really matter. And if for some reason that label comes off, you can always take a Sharpie, because I know it can get stuck to their clothing or they peel it off. You can take a Sharpie and just write it right on here. Sometimes I see the PIC team just does that instead of actually putting it on a piece. But it does stick down pretty well.
You can also put it right across here and it'll help hold the top of the pants down.
Yep. Now, we want to use this type of dressing. The type that has actually the fabric white part around it seems to hold down better. You know what we forgot to do? Forgot to put the cleaning stuff on it. I tend to forget this when I'm talking about it.
Yep.
This step, we should apply that first around that. It does two things. It actually protects the skin, and then it makes it a little bit tacky. So you kind of got to wait for it to get a little tacky, and then you can put this down on top of it. But that actually helps it to adhere better and stick longer for like the entire 7 days that we want it to stick. So that's useful. But this type of dressing is better than the type that I believe than this, because this is just your clear plastic all the way on the outside, and it's a little bit like saran wrap. Once it starts peeling up, it just keeps going. And then it gets stuck onto itself, and then it won't get stuck down. Now, we want to, when you're doing the assessment of this dressing, every single time you assess your dressing, you want to look for peeling. If it's starting to peel up, but it has not broke this layer yet, then you can advance that down with some other Tegaderms and make that stick better. If it starts to peel up and there's like a gap under there, you got to change the dressing immediately. There's just no way to wait for it. So, of course, we want to make this dressing last as long as possible for 7 days, but only if its integrity is really good. So when you're looking at it, you're looking to see if there's any drainage. If this biopatch is starting to swell up, there's drainage. We got to get it out of there. If it's bloody under there, it's time to change it. If they say no more than 24 hours, do you let that be? Now, the problem is some of our dressings are on new lines and they ooze a little bit. So we're actually testing a new product right now to see if that will help that. But we want to get it changed within 24 hours because that blood is a lovely natural protein moist environment for bacteria to grow. So we don't want that to start growing. But as we're looking at it, we want to look and see, is our skin also irritated around here? There are some things that we can do. Maybe Wound Team can bring us some products that will help the skin where the dressings have been down. We don't try to use other dressings just because we know that this works better. The clinic sometimes uses their own dressings because they peel up easier after just 1 day.